Awesome. Can everybody hear me okay? Fantastic. We started right on time, so thanks for our amazing host in his rockin' pink jacket. I was complimenting him just earlier on his impeccable fashion taste, so let's give it up for all of our conference organizers. Thank you, everybody. Over the next 50 minutes, we're going to spend some time together with our esteemed panelists, just talking about holistic health, whole health, these buzzwords that you've likely heard across the healthcare sector. And I'm going to share some of my perspective from my background, but I'm going to hope to corral some of these amazing folks. We've got a lot of wisdom. We could probably spend hours here together, but we're going to try to condense this down into 50 minutes. So in order to get started with this panelist, we're going to form this a little bit more of a discussion. And so I encourage folks, as you have questions, we're going to carve off the last 15 minutes of our time together for our audience questions. But please, if you've got something that's itching, feel free to raise your hands and we can get started. We're going to do a little bit of a round robin style, and I've encouraged my panelists in some of our breakout rooms to just kind of speak from the heart, speak from their experience, and chime in as they feel ready. To get us started and to kind of warm up the vocal cords a little bit, I'm going to adjust my mic here. If I could have everyone just start off, we'll go down the row and end with me. If you could tell me your name, your current position, the company that you work for, and your interest in this topic. So if anyone would like to go first, we've got lots of hot mics on our panel. Your name, the company you work for, your current position, and what led you here to talk about this today.
Okay, I'll jump in there. Just making sure that this is on. So my name is Brian Serna. I'm with Serna Solutions based out of New Mexico. My position is I am the CEO, owner, founder of Serna Solutions. We are a behavioral health company that does telehealth, in-person health. And my interest in the topic is that mental health and issues around addiction are they're always put off to the side when we're thinking about holistic health. Especially, just in the medical community in general. And my interest is to break down the over-specialization of some of the things that I see, and that we should be able to be more integrated as we respond to people in a holistic way.
Thanks, Brian.
Hi, my name is Natalie Jordy, and I'm the founder and CEO of True Alignment Academy, where we help nurses, first responders, and healthcare workers heal from trauma. We have a cutting-edge technology that uses a subconscious approach that gets to the root. It's a permanent solution, and then we teach them how the brain works, how to process their emotions, regulate their nervous system so that they can take control over their own mental health. So my interest in the topic is that's exactly what we do. It's all about the mind, body, and soul, and then giving our clients the tools so that they can take control over their mental health and their body and drive them to a place where they actually want to take care of themselves and start changing the behavioral patterns behind that.
Thank you, Natalie.
My name is Liz Connolly. I am the founder and president of the Thin Line Peer Support Team Incorporated, based out of Connecticut. I am a paramedic and firefighter by trade, and my interest in mental health is that firefighters, police officers, corrections, tow truck drivers, ER nurses and doctors, military, veterans and active service personnel, and obviously closest to my heart, EMTs and paramedics, are faced with trauma every single day, and we do not get the mental health support that we so desperately need. First Help, which is a nationwide organization that tracks the suicide rates of first responders across the country, estimated that the normal adult sees 2 truly traumatic events in their adult life, whereas a first responder will see 183 truly traumatic events in their adult life. That's a difference of 181 truly traumatic events. And the suicide rates for first responders are astronomical. Everybody's heard of the VA campaign for veterans, that 22 veterans commit suicide a day. The rates for first responders exceed that, and nobody's talking about it. So the Thin Line Peer Support Team, our mission is to provide peer-to-peer support so that no first responder, no veteran, no active service personnel ever feels that they are alone, that they are fighting this battle by themselves, And if we cannot reach somebody with just peer-to-peer support, we act as resource brokers, and we are able to put them in contact with either mental health support with an LCSW or a clinician, or we are able to get them into contact with drug and alcohol resources or whatever other resources they need to continue their mental health battle.
Thank you, Liz.
Hi, my name is Matthew Edwards, and I'm the CEO and founder of the Me Method app, as well as memethod.com. It is a preventative care approach to mind-body health. And I believe having good mental health is a series of different daily tiny habits that can be incorporated into a lifestyle, and it doesn't have to be complicated. So there's a quote earlier that was spoken about, Einstein's quote about simplicity, and it was something in the nature of make it simple, but not simpler than it has to be. And so my goal is to simplify your health. And in order to do that, I think it takes coming up with some routine consulting strategies based on your personalized, individualized situation. And so what I'm doing is I'm building an app from the ground up on the front and back end to create a system that I'm calling the Method. And Me Method because me is you. And it's really about you taking control over your own personal health in terms of, you know, mind and body. And really, that approach for having an optimal, you know, mental health, which is a series of different things. One, it's movement. So this can be as simple as walking or doing some chores around the house. You know, two is you could call that fitness if you're really into it. I personally have created a program that is focused more on improving your posture and alignment, because when you have good posture, you actually have better confidence. You're able to sit in your chair longer at your desk. So it's a much more functional approach to movement and fitness, and it doesn't actually have to take a long time. So there's a series of functional movements that I put together, and a way where you can actually recover from those and do it for the rest of your life. So you could be, you know, 15 years old and just getting into this, or you could be retired, and the method would work for you. It's just a matter of putting variations on those movements. So I say 3 hard, 3 soft, 1 off. So 3 days, putting some form of resistance on your body. This could be through body weight. It could be through, you know, Pilates. It could be through walking, literally. And 3 days soft, which would be more of an active day. You could focus on your productivity, your work, you know, family, all your obligations. And then 1 day just completely off. And on that off day, I think it's really important to focus on the second thing, which is mindfulness. And, you know, it's a word that's thrown around a lot. I think it encompasses a lot of different things. So there's a lot of studies, scientific studies on human trials that have come out recently, the National Institute of Health, as well as other publications, which is what I usually incorporate into my strategies, stuff that works for humans, is, you know, the power of prayer and meditation. And it's actually shown to decrease stress, improved heart health results, able to make you actually smarter by clearing out your mind and just sort of like noise that exists within the mind, because we're all being hit by different stimuluses that stimulate the brain synapses, and opening up the frontal cerebral cortex is actually very important. And so in my program, I've basically put together a 7-minute prayer meditation that you can do as your quiet time or as your moment of silence, because all the answers are usually found in silence. It's kind of the opposite of what you would think. The whole thing is actually the opposite of what you would think, because less is more, and it's really about quality over quantity. So the next approach to having good mental health is nutrition. And I've basically created a home cookbook as well as an eating out guide for restaurant recommendations and easy, simple orders, scalable meals you can make for your whole family, even travel guides of like what to eat when you're traveling, such as this conference, etc.
So,
And
Matt, we're actually going to get into some more tips here, and I'm loving where
All
we're
right.
going because I'm going to have you
Sorry, I'm
circle
really
back. No,
passionate about
great.
this, guys.
This is fantastic.
But I'll cut it short by saying I wasn't able to find a solution anywhere in the world for something where you could get all this information in one place. There's all these people that are really focused on this, all these people that are really focused on this. So after the global health pandemic, I felt like I wanted to educate myself I have a background in entertainment, a lot of on-camera movement type of stuff for modeling and national commercials and stuff. And so for me, it was about, all right, how do you simplify this and make this information available for the general public, for corporate wellness, for day-to-day strategies. So
It sounds like a really holistic approach to
hopefully we can go
bring
into
it all
more,
together.
and
Absolutely.
I can finish up because really I think when people know the right information, you can actually simplify your whole life. And I think that's the goal, and that's how you can make the best impact on whatever you're doing business-wise.
It seems like the most holistic approach. Many of our panelists so far have mentioned this aspect of needing to simplify your life, take things in an integrated approach. So as we wrap with our introductions, we'll pass it over to Marcel and wrap with myself, and we'll dive into some more questions together. But for my audience, as you're listening in, as you're starting to think about some of these concepts, I encourage you to think about this from a personal perspective and also from your own healthcare systems and how you start to integrate holistic and whole health into your systems as well. But Marcel, take it away.
Thanks. Yeah. My name is Marcel. I am the Chief Financial Officer of Medexus Pharmaceuticals. We are a specialty rare disease company, stem cell transplant, certain orphan diseases. So we sell drugs for just a very small part of the population who have that disease. But I've been in healthcare for 20 years. Grew up in Novartis, and the topic is very interesting to me, just as an overall concept. Yeah. And I'm looking at it as the body, the mind, and the soul all together, because all those three pieces have to go together ultimately way of looking at life. So a very interesting topic, and I'm looking forward to my colleagues' comments.
Thank you. And last but certainly not least, I'll go ahead and introduce myself. My name is Taylor Hooker. I'm currently a health systems specialist with the Department of Veterans Affairs in the Office of Health Equity. And starting Monday, we'll be taking a new position as the Chief of Learning Engineering for the San Francisco VA. As a clinician, prior to working in healthcare administration, I got my start as a recreational therapist and a whole health coach. And so my primary focus is helping veterans, but really veterans are representative of our entire American populace, find holistic approaches to take power, like many of my colleagues have been mentioning here, taking charge of your own life, simplifying what matters to you, and really taking charge of your own health and life and not allowing that to just kind of take charge of you. And I think these are themes that we've heard all throughout the conference this past couple of days. And so my encouragement as we are talking about some of these questions, if you have your notepads nearby, you're going to hear some kind of thought questions that I encourage you to really marinate on yourself as you think about your own health journeys and see how this applies to you personally. So thank you all for those lovely introductions and for giving us a little bit of background. We have a wide gamut of folks on this panel with a plethora of different experiences. But holistic health, holism, whole health really touches all of these different areas. So my question to each of my esteemed panelists, and we'll try to keep these responses between 1 to 2 minutes, is what does holistic or whole health mean to you? If you could define that.
All right, I'll keep it short. Minutes. Holistic really is all about the when I look at it from the physical, the body, the mind, intellectual side of the house, and then I added the soul part to it, so the whole belief system, and each of them have to be in balance. And if you look at the body, mind, and soul, it's sort of how all these actually impact our physics. So that's interesting how a thought can biology. All of the.
Might have to share a mic.
This is better. Yeah.
Better.
So really, the three of them have to interact interdependently, and how they all come together at the end of the day. And if one of them is out of order, then this is when people get sick. And one of a powerful statement I heard from one of the panelists earlier was like, healthy people recover faster. And to me, that was sort of a powerful statement to say, this is not just to be healthy, but if everybody gets sick at some point, and you know, stress causes you to get sick, but then you have to recover. And if you do that, if those three things are sort of in balance, then I think we have a better chance to recover.
Other folks.
So what does holistic mean to me? So ultimately, it's the approach of looking at someone as a whole person. It's the mind, it's the body, it's the soul. And I think holistic, as we look at this topic, whenever the majority of people solely focus, and this is just the way the brain works, on themselves. And they don't have room to hold space for anybody else. So when you look at a holistic approach, what you want to make sure that you do is you have the space to hold for the whole person, that you have the space to hold so that they can feel seen, heard, known, and understood, and you can identify exactly what they need, because each person's needs are different. Plus, the mind, the mind and the heart, it directs the body, right? So when you look at the holistic, you can't do a lot with the body if you have a block in the mind. Because if someone has a limiting belief, I deserve to be punished, I'm not good enough to have X, Y, Z, since 96% of everything that we do comes from the subconscious mind, if that is the correct statement according to the subconscious mind, no matter what you implement in that person's life, they're not going to do the self-care or the things on the other side of that limiting belief. So I think there's an order to it also as you look to this holistic approach, so that to ensure that the continuity of that, you have to address certain things in a certain order.
So from my perspective, you know, in preparing for this panel, I was trying to think, well, what do I have to offer that might be unique? And that, you know, I agree with all my colleagues here. But one thing that I have that might be unique is I have an extensive background working with tribal communities in health and wellness. You know, for a lot of years, that was my title, actually, the Health and Wellness Director for Native American tribe. And one of the things that I've learned in that experience is it's not just what you eat, it's not just how you move your body, it's not how many prayers you say or meditations you do. It's also your relationships. And so I think that when we think about health and wellness, especially in the context that I'm thinking about it, is it's multi-generational connections, or connections to your community. You feel connected to other people. And I feel like sometimes especially with those who are contemplating suicide, for example, a lot of them feel so isolated. Even though, like in their profession, everybody's going through it, but they still feel isolated, and that I can't handle this, I am weak, and it's just so much focus on just, you know, them in isolation. And I feel like you know, whether it's health and wellness or even recovery, like from addiction or a mental health challenge, it's your connections that not only help you with recovery, but they also provide a really important layer of resilience. You're not supposed to do everything on your own. And I feel like in America, we really hold up this idea of the rugged individual that can withstand anything. And we're not supposed to be like that. That's unnatural and it's unrealistic. And then, you know, and so we do need to cultivate those connections to other people as it relates to wellness. Yeah.
I think what holistic wellness means is, you know, how everyone touched upon, but interconnecting, you know, mind, body, spirit, but also to relationships, to business, and that, you know, going back to the relationship thing, that's your relationship with yourself, with God, you know, or whatever you believe in. Because you really do have to have, you got to believe in something greater than yourself. Because, you know, there's going to be seasons in life that are good and that are not. And it kind of ebbs and flows, just like the weather. And I think it's really important to, you know thyself. And to know thyself, you know, we all have our own individual purpose. And in order to fulfill that, you know, we have a mission in life, and everyone here has one. And I think it's really important to come into that and be who you were authentically created to be. And when you do that, you can actually change your cellular biology. You can improve your confidence. You can decrease your stress. You know, you can improve your appearance, and your daily living becomes inspired because, you know, not only for yourself, but maybe others. And that's when you know you're approaching the holistic thing from a holistic standpoint. And, you know, anxiety, depression, loneliness are these problems that we're dealing with in society today that play into the mental health thing due to, you know, the breakdown that has been caused by the global health pandemic of this new communication strategy that's become digital. And everyone here has been on a Zoom call where you're doing whatever and your screen's blacked out and, you know, you're trying to get something done. And the accountability factor kind of goes out the window. And I think there's really the solution is to really go back to the basics and master the basics. And when you can do that in the areas like fitness, nutrition, you know, using products that are clean from the source, and having some form of, you know, mindfulness in your life that doesn't need to take a long time, then I think you're better equipped to perform under pressure and to lead teams and to provide value in your company, be a better employee, be a better, you know, husband, wife, friend, and, you know, that will allow you to want to be more social and want to be more successful. And it starts really with you. And yeah, that's why I like what I'm creating, this me is you concept. And you know, filming all of the long form content of these various situations that are universal that I believe we're all in. Waking up every day, doing something in the mirror, you know, going to bed at night, working, maybe working out, eating and drinking. It's really, all of this stuff plays into everyone's life. And so as humans, you know, we're all playing on the same page. And as technology changes, unfortunately, human nature doesn't. And so that's the constant that holds us all together. And so I think coming together and, you know, trying to approach each individual for who they are without judgment can allow a much more mindful or mind-body holistic approach, not only to, you know, wellness, but also to life. So hopefully that can give people more of an open-minded perspective, regardless of, you know, your background or belief system. I think it's super important, and that's really what's going to give us more of these solutions that can be implemented into corporate business. And once again, it doesn't need to be complicated.
I think for me, a holistic approach to health, building off of something that Brian said and something that another panel yesterday was talking about, really goes back to community. Something that we see big in the military community is the buddy system, and something that I see a lot when I'm dealing with veterans, and something that I found a lot having joined my state militia, is when I joined the state militia, I immediately found a sense of brotherhood. I immediately found a sense of family. And for a lot of veterans that we're dealing with that are in mental health crises, they've lost that sense of community. They've lost their buddy system. They've lost their relationship. They've lost that sense of grounding because they don't have that community anymore. And that, for me, I think that holistic, you know, everybody keeps going back to that mind, body, soul approach. For a lot of us, I think we know that we need to take care of our bodies. We need to take care of our minds. We need to take care of our souls. And to an extent, I think we all know how to do that for ourselves. But I think the piece that we all kind of forget and that we all need to focus on is the community aspect, taking care of each other, taking care, you know, especially if you're in that position of management, of leadership, and you have the ability to affect your communities, to affect your companies. What are you doing to be able to take care of your employees? What are you doing to be able to, like, for example, in the first responder community, paramedics in Connecticut typically make around $30 to $35 an hour. Paramedics are typically working 60 to 90 hours a week, if not more. What time do we have to be able to take care of ourselves on our off time? Because we don't have any.
Yeah, Liz, that's a great point, and actually leads me to another question. So I'll provide a little bit of a definition of my perspective on holistic health. In fashion of, we've talked about like these different domains of health, whether it's cognitive health, behavioral health, your mental, spiritual, emotional connection. Are there areas, and I'm going to throw this out to my panel, I'm going to build off of what you say, Liz. Are there areas of our entire experience as human beings, this whole health wheel as we start to think about it, that folks tend to miss? And so, Liz, you've brought up community, and that's also struck in me recently. For folks that kind of follow public health, the U.S. Surgeon General has recently put out a advisory about the second pandemic that we're dealing with, this second pandemic of loneliness, and that as a society, loneliness and isolation is more deadly than smoking a pack of cigarettes a day. And we can give blanket advice to people like, get out in your community, get involved, volunteer, make a friend. But the challenge is, as adults, which I'm going to assume everyone here watching would fall in that category, it really is a challenge to make friends and find community as we move into different roles, we move across country. The pandemic certainly didn't help that at all. So one of my distinct privileges as a recreational therapist is teaching people how to use recreation and leisure as a coping skill. And so I might encourage folks to start to think about, how do you operationalize some of this stuff? We talk about conceptual things about holistic health, what it means to us, but how do we individually start to take stock of how do we start to move that needle in our own life? So I'm going to ask my panel to kind of marinate and think of some questions. But one of the questions that I might encourage the audience to think about, and this is kind of a 1-2 punch, so I apologize out of the gate. But as you're scrolling down on your notepad, the question is, what matters to you? What matters to you? What do you live your life in health for? So what matters to you, and what do you live your life in health for? And I encourage folks to marinate on that for a second, and we'll start to build off of this conversation together. So I'm curious to the rest of my panelists, are there questions throughout your experience as a human being, as a professional, as a healthcare worker, like many of us are? What are some of these questions that you ask yourself when you maybe need a little bit of a litmus test, or you're trying to check in with the holism of who you are as a person and your whole health? How do you take that pulse check?
I think that's a good question. I think everything is a system, and for example, the body is made up of massive amounts of systems: the endocrine system, the respiratory system, the circulatory system. The list goes on. And when you pull into your laptop to do work for whoever you're working for, or yourself, you pull into another system. And you go on social media, there's another system. You're here at the conference, it's part of a system. So I think you have to be in a system, but you also have to go outside of the system and make some personal decisions and come back into the system. So no one's telling you to go outside of the system, but sometimes there are areas to check in or reset, such as, the mindfulness or the spiritual part, or whatever you want to call it, that is outside of the system, where you can't really put like a number or, a necessarily track that. But I think that's actually where you can make the most progress. So, the communication of that, and however that works for you, like for me, I take a walk and I just get all of my best thoughts clearing my head on a walk, usually outside. At some point, it could literally be to the car on the way to work. It could be on a commute. It could be to end the day, like whatever, breaking up the day in the afternoon. I think for me, that's like what I like to do to get that reset check. But for some people, it's like their coffee in the morning, or, doing focused work, or, a lot of people find it to be very meditative to, just make a meal, or to have a one-on-one conversation with somebody else has some form of depth, regardless of if it's, useful or not. But, implementing some of those systems for yourself that whether you're an introvert or an extrovert, if you're an introvert, you just kind of need to be told everything's okay, right? You're working from home, everything's going to be okay. If you're an extrovert, you kind of need some interactions out and about, right? So to, combat loneliness and, these things that are the silent killers, right? Anxiety, whatever. Implementing a couple of those systems for yourself that could be outside of the system, but for you, it works. So for me, it's a walk. For you, it could be, whatever that is.
And to reset that question, are there opportunities that folks can take stock of, questions that they might be able to ask themselves, almost like a litmus test that folks can check in and kind of take stock of where they are on their holistic health journey?
Sure. I'm going to kind of steal a concept that you and I were talking about. And, I think in this group in particular I'm just going to just blanketly call you achieving professional people. Ask yourself, what do I do for play? I think that adults forget to play. We don't prioritize play. And what I mean by play is not playing some game on your phone, right? Or even video games for that matter, because neurologically, those are not states of rest. And when I think of play, I think of something that puts you in a flow state that actually recharges you. And that could be painting, it could be walking, like Matt was saying, it could be anything. It could be lifting weights, martial arts, it could be just literally playing with children, right? And I think that that's where I think a lot of us just neglect ourselves, because we just don't play.
You make me very happy as a recreational therapist when you mention the word play. Absolutely.
I kind of giggled at your question, like what matters to you. So I was definitely my own first client, and after being a nurse for 16 years in trauma and critical care, I was so burnt out and in survival mode, I probably wouldn't have had no comprehension of that question whatsoever. My survival mode was to the point where I could not sit down. I could not sit still. You put me out to go on a vacation and my skin would crawl because my nervous system was so dysregulated. My hypervigilance was so at the surface. And what matters most to me, what are you talking about? Nothing should matter to me. My job is to take care of everyone else around me and to survive. So even to think of what matters most, which I think is why, if you have a company or a healthcare system and you're looking and trying to figure out what do we need to do to help this, our staff be more holistic, let's look at the survival mode rates. Let's look at their nervous system regulation. Let's get the trauma taken care of that's the war under the surface first before we can ever move on to other approaches. Because play was absolutely out of the question because I just could only survive. Even on vacation.
One of the two questions I'm asking myself is, what am I doing here and why? And this comes back to like you're in a situation where you're on your own. You mentioned loneliness, and they say, well, yeah, you may gonna go for a walk, yeah. So you take that step, or you're actually surrounded by too much noise, and you have to actually get into some like quiet space, yeah. Or it's just simply health related, and say, why I'm eating so much, yeah, I'm gaining weight, and have to do something else, yeah. So what I'm doing here and why, just to ask on a regular basis and just get out of your comfort zone. And now we talk about systems, but a lot of it is actually out of the comfort zone, and we're so comfortable doing things, yeah. I don't think a lot of people are comfortable talking in public. A lot of people are comfortable doing those things, but stepping out of that helps you to actually just get a little bit ahead of yourself and then just question things, yeah.
So pushing past that discomfort is really important. Absolutely.
Yeah, building off of what Natalie said, being an EMS, when you're constantly barraged with that trauma, it never gets shut off. Going on vacation, first thing we would do is find our emergency exit routes. If I was on vacation, I have to be sleeping closest to the door. I knew exactly how many paces it was to get from my bed to the door, how many paces it was from the door to the stairwell emergency exit. I can tell you how many paces it is to get from this door to the emergency exit outside. My brain doesn't shut off when I'm on vacation. Even when I'm supposed to be on vacation. Although this is technically a work trip, so does it really count as vacation? But I guess your litmus, for me, I guess my litmus test is in something, building off something that Marcel just said too, is think outside the box, play. What's something that brings you joy? What's something, everybody thinks about, rest and relaxation, everybody thinks about fitness and working out, that's supposed to help build endorphins and help build serotonin. I hate going to the gym. I can't stand the thought of going to the gym. The thought of walking into a gym and being around a whole bunch of sweaty people is the most cringing, skin-crawling idea in the world to me. But I happened to go and do ballroom dance one day with somebody, and it was the most awesome, coolest thing ever, and I ended up doing it for the next 10 years. So.
Dancing. I agree with that. Get out and dance. I have the most fun when I'm dancing. Also, if that does require you to have some alcohol, that's totally, it's a big myth, because if you're lonely and you're just sitting there at home and you can't sleep and you're struggling with sleep habits, you're actually better off going and doing something social, whether that's having dinner with your significant other or a friend or literally just that one person that you can call, or going to dance or going to have a drink out. A few drinks is not going to do anything in relation to what you do consistently. So it's actually a myth that you have to sacrifice your social life and be this wellness guru type of person. You can actually have an amazing social life and be very normal and still completely optimize your health in a very way that can transfer over into the corporate world, into your home. And yeah, once again, all of this stuff can kind of get you out of your head. And the more you can get out of your head by doing something that is, stimulating, including even the mindfulness part, actively meditating, actively praying, actively taking a walk, but actively doing things with the mind-body connection is really the way to solve mental health. So it does require action, unfortunately, and the more passive mindset, sort of reacting to stimuluses and response, the harder it is. So that's why I think it's so important to set some of these, take a macro overview of your routine and these daily habits that you perform on a regular basis, which are almost ingrained in us. And, habits are very difficult to break, but just stepping back out of the system and sort of looking at it and thinking, okay, what is it that I'm doing every day? Because I'm a product of what I do every day, period. So what is the product that I'm creating on a daily basis? Because over time, when you put in time and effort into something, it usually turns out you're usually going to get some form of outcome. And hopefully, you can learn from the mistakes. And I make a ton of mistakes all the time, but I think this whole fountain of youth and wellness thing is about, having an open mind and being willing to learn. And when you're willing to learn, you're willing to change. And if you're willing to change, you're willing to, make progress. And it just takes, sometimes it takes, hey, what should my left and right be today? Just do it kind of thing. It doesn't need to be this massive change. So it could be that one little small thing. And I think that's the most important thing if you don't know how to get started, or you may not be an expert in different things. You just kind of want to get better. Just start.
So we're going to take some audience questions in just a moment here. To build off of that comment about like how to operationalize this, I can't say it enough as a therapist and a health coach. I am a therapist, I am a health coach, I go to therapy, and I have a health coach. And so as much as we can normalize those two processes, to Liz's point about the impact of trauma, we can't even have this discussion when we're in that fight and flight mode, when we're in this responsive reactive mode. So we have to really address those underlying traumatic pieces before we start to explore building on some of those pieces. My life completely changed when I went to therapy. My life completely changed when I worked with a health coach. We have to believe in these processes as much as we tout them to our clients. We need to take stock of them as individuals as well. In the remaining 8 minutes that we have together, I encourage folks from the audience, we have a microphone here in the middle of the room, to come on up, ask questions, provide some perspective, but we'd love to hear from our fellow audience members, and it looks like we're live. If you could introduce yourself, let us know your name and your question.
Certainly. Happy Wednesday, everybody. My name is Ro Patak. I represent Elevation Capital. We are a multi-business private equity firm with a heavy presence in the CBD kratom space from a CPG perspective, as well as multiple holding assets. So possessing the myopic viewpoint from the financial perspective, open question to the panel. Matt, I'd like to hear from you first. If you were to look on a macro level at the unit economics, and specifically where you see the biggest opportunities ahead, what makes you most bullish or excited from all the different lessons you've learned, either from your own experiences, through some of your fellow esteemed colleagues here who have been recognized with awards?
Yeah, I think I see the biggest room for disruption and growth, I think, in the media space around health and wellness. I think it's top of mind globally. The word health is top of mind globally throughout corporate business and, in homes more so than ever. And I think, creating video-based content that's long form, that can actually provide solutions and take you through the entire process of how to do something, as opposed to what we're seeing a lot now, which is short form content, and then giving people the ability to express themselves through short form content as a mechanism of validation and accountability. I think that chain reaction is really what can create a flywheel effect that, can build a community. And like what we're all talking about here is, you sort of have these core values and you try to embed those into the world the best you can, but really what makes the most impact is how do you build a community? And I think the fastest way to do that and the most effective way is really in the digital health space and through SaaS. And, SaaS is software that is scalable. And when something is scalable, you can communicate the message more effectively to more people in a more macroeconomic way that can not only be more lucrative long-term, but also more efficient. But however, although I do believe, digital health is the future, and there's a need for technology that actually provides these sort of solutions in the most holistic way, whereas, there's a lot of apps out there, there's a lot of programs out there, but there's not a lot of all-encompassing programs, and I think that can be implemented into corporate wellness. And I think it can also be implemented into, like from a B2B perspective on SaaS, but as well as a B2C perspective.
Yeah.
Right. So you see this opportunity through potential integrations with these large enterprise players who, are valued at $1 trillion at any given trading day. And so I believe we have some colleagues here with questions. So I'll be brief. I really liked your point about the differentiation between the short-term and long-term opportunities. Could you just elaborate a little bit more on what that means from a content perspective? And
Yeah,
for the
yeah.
layman's,
Yeah,
can
so
understand.
smart people basically view content long form. So, for example, most people in this room would watch a movie or a TV show or a podcast or a TED Talk or a YouTube episode, or, buy a course and go through the course and complete the course and read a book, depending on what type of learner you are, right? So,
And Matt, those are versions of long-form content. Is that correct for our
that
audience?
would be an example of long form content.
What would
And
be an example of short-form content?
So, maybe like a couple different people on YouTube. Whereas short form would be more, these quick hitter commercials or things that you're seeing on TikTok, which is a short form content app. Instagram Reels. These apps are created by people that want to get you addicted to an algorithm, right? And so most people are in an algorithm in which they're living not just from, a AI perspective, but also, a habitual perspective. And once you're sort of in that, it's tough to get out of that rut. And so, I like coupling, what I'm trying to do is couple long form content so that you can really gain trust and, authenticity. And that's what's really what it's about. And then you can give people the ability to post short form, which is actually more of a social response for the human, because we're all social creatures, to, basically validate that we're part of a community, that it's almost like a motivational, inspirational dopamine hit. So a lot of these things that we've all spoken about, movement, food and drink, that's good. Interactions with people, mindfulness.
Matt's point.
These are dopamine hits.
Matt, we just have a few more minutes left, so I want to give some opportunities to some other folks. But to build off of that point, there's a key introduction around when we talk about tech-enabled care and human-centered care. We have a lot of these platform-based, app-based programs that have multi-million-dollar valuations, and that's amazing and that's important. I think one of the key things that a lot of these opportunities are missed upon is, yes, the content, but then how do we operationalize people to actually connect in their community? So for me, what we're seeing in the data with some of the companies that I work with outside is finding that happy medium between engaging content and actually engaging people to operationalize themselves, to get out in the community, get connected, take power of their own health, and not just live on that phone and device.
Right. So you view it more as operational than technological, as far as
It's got to be a mix.
It's
got to be a
certainly
mix.
a hybrid, right?
Yeah.
Because there's always going to be a human element to it.
Absolutely.
Thank you so much.
Thank you.
Hello everyone, my name is Pulkit Gupta. I'm setting up a plant-based vegan vegetarian cafe over here in Las Vegas. Thank you so much to all the panelists. This was an incredible panel. Got to learn a lot. I'm curious to get some insights on what is the future of nutrition in the healthcare system. There was a panel yesterday around the early termination of pregnancy, but nobody really talks about the nutrition aspect of what is being fed to mothers giving birth at the hospital, to the postpartum food these new mothers are eating, and also the food which is being offered to healthcare professionals who are working at hospitals and other revered health officers. So what do you think is the future in terms of offering these people, higher quality food, which would in turn make the people perform at a higher efficiency long run, saving millions of dollars to the healthcare system in long run?
Unfortunately, I don't think we'll be able to answer that question today, but I do encourage you to stay back and talk with our panelists. But nutrition is a core component of this holistic health, just as all of the other domains. I am probably going to get my gold hook here soon, so I just want to say thank you to all of my panelists today for your esteemed wisdom and for sharing of yourselves. If folks have questions, our panel members will stay behind to talk with you. But thank you for this opportunity. Thank you for everyone for your questions and for listening. And congratulations to everyone on the panel. Thank you.